Well, this is a really good opportunity for parents to do the umbilical cord blood banking. If you have a parent, a family member, first or second degree family member that has a disease that we know can be treated with umbilical cord blood. For instance, we are able to treat cancers, immunological diseases, storage diseases, several blood disorders like leukemia, lymphoma, sickle cell, aplastic anemia, then it's more imperative that you consider umbilical cord blood banking because you have a family member that could potentially benefit. We know that it's very difficult for some family members to get a match in the bone marrow registry, and so as a result, you really want to look to a family member who may be a very close match. In fact, using umbilical cord blood, you have to be less of a close match to do a transplant than with bone marrow, where you have to be a very close match. And this is why it's hard to find an appropriate match in the bone marrow registry. If you do have a family member who needs a transplant, there's one company called Cord Blood Registry which has a program called the Designated Transplant Program, where if a parent has a first or second degree relative which has a disease that can be treated with umbilical stem cells, they can collect and store that umbilical cord blood for free. In fact, the company will allow you to collect those stem cells, will process it, store it. I think all you have to pay is a shipping fee, if that. And in fact, they'll make those cells available for a transplant if necessary. And in those situations, I think it's an absolute no-brainer in terms of collecting those umbilical cord blood stem cells.